Welcome to Healing Your Life with Sophros Recovery. I'm April Davis, along with the clinical director of Sophros Recovery, Erin Moran, and a senior therapist there, Linsey, Mizic. And just to give you a little background on the two ladies who are joining us here today, we're always talking about addiction and recovery each Sunday at 1 p.m. Linsey Mizic is a senior therapist. She received her Master's of Science in Clinical Mental Health Counseling, and she utilizes varying tools in her therapies related to the mind, body, and soul connection to gain a better understanding of not just ourselves, but the world around us. And we also have clinical director Erin Moran, a licensed mental health counselor and certified group practitioner. She received her master's in clinical mental health counseling from the University of North Florida and began her career as a therapist working at the UNF Counseling Center. Erin believes in treating the whole person and working toward healing the mind, body, and spirit. Welcome, ladies.
Thank you.
Thank you.
Happy to have you here, and today we're talking about addiction as a disease. Of course, you know, that has a term that's been out there for alcoholism, and it's becoming more well-known and acceptable. And if somebody wanted to stop using, is there a reason why they couldn't just stop? I mean, I think people that maybe are not addicted to a substance really struggle with that and don't understand why someone can't. So I guess that would be a good sign that you have an addiction issue.
Yeah, that would be kind of one of the first points of recognizing, yeah, maybe I need help. Maybe I can't do this on my own. Is it someone who's maybe not wanting to use as frequently, as much? Maybe they're not wanting to use at all and they can't. There's a lot of different beliefs on, addiction. Is it a choice disease? Is it a brain disease? Is it something else, altogether differently than both of those? The way that I like to view it is, if it was a choice, who would say, I want to get in line and sign me up for addiction? If it was a choice, we wouldn't continue to use despite there being consequences. There are people who have lost jobs, who have huge financial consequences due to it, whether that's through losing the job or through legal issues. People who have gotten DUIs and can't drive and are now inconvenienced and, having to figure out, how do I get to work? How do I get groceries for, months on end? There are people whose relationships kind of blow up and explode, and there's a lot of conflicts to them. If it was fully a choice, people wouldn't choose it. Mm-hmm. At some point, what happens in the brain, in our body, is that choice point gets taken away. The very early stages of addiction or of using a substance, we probably could get to the point of saying, this isn't great for me. I think I need to pull back a little bit. Once we sort of cross that threshold of addiction, it's now something that either we can't stop because physical issues are happening. So that could be cravings, that could be withdrawal. It could be, the mental and the emotional components of, okay, maybe I don't want to use, but I don't know how to navigate life without this substance.
All right. And so is there a medical reason? I mean, you chemicals in the brain, something like that explains why people who have addiction issues with drugs or alcohol just cannot figure out a way to stop doing it, because as I've heard it explained, if you're quote unquote normal or you're able to stop, that means you're not addicted. And so, like I said, it's kind of hard for people that can choose to understand why you cannot. So is there a medical explanation?
Yes. So talking about kind of some of the pieces that Erin used, the example I often use when we're talking about addiction as a disease and not a choice is, I ask all my clients, did you wake up one day and just say, yeah, I'm going to be an alcoholic. I'm going to be an addict. This sounds like a good time. I'm going to make things hard. I'm going to create chaos in my life, and I'm going to, make things more difficult. And so, the short answer of that is yes. Addiction as a disease there's predisposition, there's chemical components of those things. Being able to think about how that overall impacts you.
Yeah. And so I think your brain actually has, there's dopamine that we know of and things like that can obviously be different and from one person to the next. Is that have some effect on addiction?
Absolutely, it does. Your brain chemistry starts to shift. your body now is no longer releasing some of these hormones that we release naturally, that exist just being a human, just us existing, happens in our bodies, in our brains. When you start to impact sort of the pleasure system of our brain, now it's saying, oh, I don't have to produce as much of this because this substance is bringing it in, or the substance is changing the levels of it. So it starts to hold back. Your brain starts to pull itself back and saying, I'm not going to release as much because this other thing is going to come in and it's going to give it for me. So when you stop, now you're at sort of this deficit. That's why it becomes really hard, is because you're having to push through and you're not at baseline levels. That's the part where it's really hard. So not only are you going through is the potential of the physical withdrawal, the emotional component is my brain doesn't have the resources that it maybe needs, that it maybe once had before I started using this substance. That's why we come in as a treatment center and start to develop alternative ways of coping to really get to the point where our brain can start to get back to more of a homeostasis level. But absolutely, medically, it is impacting your brain chemistry.
Yeah. And we know alcohol is a depressant, so we'll talk about that in just a second. But if you think you're resonating with some of what Erin is saying and what Linsey is talking about, our senior therapist here with Soft Roast Recovery, you can always give them a call, even if you just have questions or if you think you're ready for treatment and you are in the middle of addiction. You can call them at 904-439-4805. Again, 904-439-4805. You're listening to Healing Your Life with Soft Roast Recovery. I'm April Davis here along with Erin Moran, the clinical director at Soft Roast Recovery, and senior therapist Linsey Mizic. And we're talking about addiction as a disease. And I was saying, we know alcohol is a depressant. So if you, and you guys deal with other substances as well, but how does alcohol in particular have an effect on you not being able to give it up?
So thinking about this, if alcohol is a depressant, that is, a lot of times we're like, that means you're going to be depressed. Yeah, maybe. What it is it's kind of slowing down some of your systems. That's why we say, your reaction times are going to be a little bit different. People who think they're driving a car and they're like, I'm doing this great. From the outside, a sober person is like, this is not great. What you're seeing versus what reality is off. So imagine that compounded over time. That sense of offness, that sense of connection and awareness to self and to navigating these different environments. Again, work, family, finances, all these different things. There's an offness in that. There's a disconnect in that. So that's the part where, yes, it's brain chemistry, it's behavioral, it's emotional, it's all of these different levels that are playing out. So that's sort of, I think that's with almost all substances, but when we are thinking of a depressant, think of ourselves, a portion of ourselves is unplugged, is offline. And the longer that something is offline, the harder it is to come back online. The more support, I'm kind of having the image of, technology. If I've had a computer that's off for a really long time, it's sort of like, you need the fans to get going. You need the juices to start flowing. It's a slower reboot, and it might need a little bit more outside technician support to get optimized running. That's the same thing. Like I tell people, our brain is the most complex organ in our body. And there's a lot of complex systems in our bodies, and yet our brain is in a lot of ways like a computer. It needs a lot of TLC and a lot of support in order to get back on track, in order to have it to be running smoothly and optimally. And that's sort of where a treatment team and external people, or sometimes medications, sometimes, going through a detox and having medical providers, stabilize you. That might need to be preventing seizures, that might need to be hydration, that might need to be a lot of different things. But yeah, it's going to require a lot of technicians in that metaphor.
Yeah, because I'm thinking, the question or the discussion was about, why can't you stop? addiction as a disease, why wouldn't you just be able to stop when you want to? And so I'm curious how much genetics plays into that. You know, are you predisposed genetically to being an addict?
Yeah, and so predisposition, it looks different for everybody. I think a metaphor that I use a lot is sometimes I'll have clients come in and they're like, but I don't have anybody in my family that struggled with addiction. I don't have any of my family that is an alcoholic, so why am I? Is the idea of you don't know how full your cup is, right? Your predisposition, you don't know how full it is, right? Erin and I may drink the same amount of alcohol for the same amount of time, and my cup may be half full and her cup may be 3/4 full. So she's more likely to become an alcoholic before I am, right? Because the difference of what those two things look like. Some people, they may have the teeniest, tiniest bit in there, and if you can continue to fill that up, then the likeliness of you becoming an alcoholic is less, right? And so it looks different for everybody. I think something that is continuing to be talked about more, and the stigma of addiction it exists but is lessening, is starting to talk about it more when we're talking about health, right? Like when you go into the doctor's office, you know, they ask questions like, do you have any heart disease, diabetes, all of these things. They may ask questions related to, you know, how many, do you drink often, you know, is it occasionally, frequently, socially, but not, do you have addiction in your family, right? To be able to teach people about what predisposition looks like, because that can put you at risk, right? To be able to say, okay, I have, you know, alcoholics on maybe this side of the family and then nothing here. Is the likeliness of you becoming an alcoholic less or more? It may be. They may never have overpoured their cup, so you might not know, right? So, but still being able to know, yes, that predisposition exists for everyone. We just may not always know what it looks like.
Yeah, you're saying if maybe that you had a parent or a grandparent who was an alcoholic or could have been, but maybe you wouldn't know it because they didn't act on that.
Right.
They didn't drink.
Yeah.
Or they didn't, you know, abuse
Yeah,
the substance.
absolutely.
Gotcha. All right, we're learning a lot here, as always, on Healing Your Life with Soft Roast Recovery here on your Sunday afternoon. And let me give you that phone number one more time before we go to break. 904-439-4805 is the number you need to call if you have questions or if you think you're ready for treatment with Soft Roast Recovery here in Jacksonville. One more time, that number, 904-439-4805. Welcome back to Healing Your Life with Soft Roast Recovery. I'm April Davis here along with the clinical director of Soft Roast Recovery and a senior therapist, Linsey Mizic. And we are talking about addiction as a disease. We're always talking about recovery and addiction here every Sunday at 1 p.m. And we want to move on to what actually happens in the brain that actually makes addiction difficult to overcome and why you need therapy and specialists to get you through this process. And we were talking about, clearly, if you start drinking at a young age or whenever you start drinking, you're probably doing it because you think it's going to be fun. And there is a reward system, right, Erin?
Yeah, absolutely.
Yeah.
No one would use substances if there wasn't a reward, whether that is some sort of pleasure and feeling good. I know a lot of younger people start drinking to help with social anxiety, to kind of let loose, to want to be able to get out of their heads sometimes. That works, you know, and then also using substances to maybe not necessarily have I want to have fun and have a good time, but maybe I don't want to feel stressed. I don't want to feel overwhelmed. I don't want to feel, you know, some of these more hard emotions. So I want more pleasure and I want less pain. And it works. Otherwise, again, no one would use it. And that's not necessarily a bad thing. It can be.
And talking about the brain, when does it stop working? You know, if we're talking about alcohol.
Yeah.
You know, because clearly for a while it's, you know, it's doing it's doing all of those things. It's rewarding you in some way. It's taking away the edge. And then there's a point where your brain's like, we're going to just be depressed. You know, this is going to flip. This script is going to flip. Yeah.
Where there's not the pleasure anymore and there's a whole lot of pain. I think Linsey has a really great metaphor that I think is helpful to understand. We love a good metaphor here. You know, if you're listening every Sunday, you're going to hear a lot of good metaphors. I love them because I think some of this stuff feels really big, really heavy, and really confusing. So sometimes when we have this metaphor, it really helps to solidify, to be like, oh, I really get that. Instead of it just being an idea or a topic, it's this image that goes along with it. So I love this image of, yeah, well, how do we know when it's gone from, yeah, this has worked, this has helped someone deal with the social anxiety, this has helped someone to be able to just have a lot of fun on their weekends, or to take the edge off of a stressful day, you know, at night. It again, I'm not saying that that's healthy, but I'm saying it works until it doesn't. So
the metaphor that I often use here is you can't unpickle a pickle. Right? So once you pickle a cucumber, it's a pickle. You can dress it up as a cucumber, you can do whatever you want, but it's still going to be a pickle. There's nothing wrong with being a pickle, but now you have to learn how to live life that way, right? Whereas you've lived life knowing, okay, like I could drink, you know, for fun. I can drink to feel relief. I can drink when I'm sad, you know. That'll take these things away until you cross that threshold, right? Until you're pickled, and you cannot become unpickled. It's not going to happen. And that, to just kind of throw a little insert in there, is like, that's a lot of the time too where we talk about cross addiction, is if you are addicted to one substance, if you pick up another substance that's mood altering, you're going to become addicted to that at some point too. And if you don't become addicted to that, it will also lead you back to your original substance.
Well, that leads me to the question, do some people do that? They think, oh, alcohol's not working anymore. Now I'm going to move on to what we would think of as a stimulant.
Yes. Yeah. And so that's also, again, that's a huge piece of addictive behavior, right? Is the addictive mindset convincing them that, well, if I can't do this, I could do this, right? Because the pleasure part of your brain is going to continue to seek that, right? It's going to continue to seek feel good. And if it says, well, somebody said I can't drink alcohol anymore, and I heard that this thing is really nice, so I'm going to give that a go, right? And you may be able to do that normally for a period of time. You will either then become addicted to that and it will become your main issue, or it will circle you right back to the thing you were using before.
And in the meantime, what's going on in your brain? Is your brain just so confused?
So it's sort of like, I think I had used this example previously, is if you were used to using the main sense of seeing all of the time, and then you just covered your eyes up and you were trying to walk around and figuring it out, right? That's essentially what happens to your frontal lobe, is that choice part is gone. So even though we can externally, as people, logically, morally, ethically see, oh, this isn't good, this is damaging my relationships, this is hurting me, this is hurting other people, the pleasure part will always win. It will always win. It doesn't matter. And so it will always trump the choice of, oh, this isn't good for me, but I'm going to do it anyway.
And isn't that amazing? I mean, we don't obviously talk about clients. There's privacy, and they're super private about anything you may tell them. But I know that you have had examples through therapy of people that have gone through wild things, really tough things, DUIs, like you mentioned before, or, you know, gone to jail, or hurt themselves or hurt somebody else, and they still go back. And so what is that proof of? I mean, what's going on in the brain when you do that?
I mean, I think, and I know I'll let Erin say a little more about this too, is like, that's the depth of shame that exists in addiction, is that exact question, right? The thing that you just asked is the thing that addicts and alcoholics ask themselves all the time. If I know this, why do I keep doing it, right? Why do I feel shameful when I know I have to go back to treatment? Why do I feel shameful when I have to tell my loved one, like, I drank today, right? Why am I feeling this? Why do I keep doing it when I know it's not good? It's that depth of shame that will fuel, well, I'm already this far, so I might as well just keep going then, right? Like, that's such a huge piece of that, is I'm already here, so I might as well keep doing it. I know it's not good for me, but if I'm going to do something that is good, I might as well feel good. Yeah.
But is there something that is happening in the brain that has to be satisfied at some point? I mean, are you damaging your brain after a certain time of abusing a substance?
Yes, absolutely. Your brain is hurting.
Yeah.
And that's the part of when we slow down and when we connect with the discomfort, the pain, when we look at the shame, and instead of just swallowing it, instead if we say, ooh, that doesn't feel good, you know, instead of if we say that guilt is telling me that I'm not aligned with myself, I'm not acting and behaving and existing in a way that is aligned with my values and who I want to be. When we slow down and allow ourselves to feel that, that is communicating with, here's what I need to do instead. But it's so hard to do that. Our emotions are trying to just give us that information. They're trying to guide us, but we've been accustomed to avoiding the pain.
Right.
And seeking the pleasure of seeking, again, that's in the brain level, that's the dopamine. It's hurting the brain because it's saying, I need more of this. Your brain's not producing it as much on its own. It's seeking these external things. And on top of that, it's numbing the natural ability to cope. So your brain is hurting. Your brain is struggling. And we're trying to avoid that, but that's where it's like, no, we need to actually just feel that pain, feel that discomfort. That is what usually allows people to pick up the phone and say, I need help.
Yeah.
Right.
But if we continue to run from the pain, to say like, I don't want this, or get stuck in the shame, I am bad. This doesn't make sense. Why am I hurting these people or hurting myself? I might as well continue to numb. It's like, well, no, if I just feel the pain and the discomfort of not being aligned with myself, that's going to allow me to say I need help. I want to do something different. And it's incredibly difficult to do it alone.
Yeah. And so if you are ready to pick up the phone, if you're in the middle of this and you need help or you just have questions, you can call Soft Roast Recovery. That number is 904-439-4805. Again, 904-439-4805. And we're here with the clinical director of Soft Roast Recovery, Erin Moran, and senior therapist Linsey Mizic. And I'm just curious, it's got to be true. And, you know, if you've ever been around anyone who is addicted to a substance, it's got to affect your thinking skills, you know. And so you get to that point, and then I'm guessing you can't make good decisions. And so how do you make the choice to get help? And then how do you decide I shouldn't be taking this substance anymore? I mean, when you're in the depths of addiction, you know, clearly you're probably doing this multiple times a day. You're taking drugs or alcohol.
I think a big piece of that is there is a TED Talk by a gentleman, his name is Johann Hari, and he references addiction as a disease of choice, meaning it starts out as a choice and then ultimately becomes a disease, right? So it's the initial piece of, you know, I could do this, you know, until you cross that threshold like we had been talking about.
Till you become a pickle.
Yeah, until you become a pickle. Yeah, until you become a pickle. And so, you know, being able to look at that and think, okay, how do I make this choice if I don't know how to make this choice? It's different for everybody. I think a big piece of that is negative consequences often will get people motivated, you know, to see, okay, I'm losing these things, whether that's physical, that's mental, that's emotional, you know, they're noticing loss. And that may be what some people may look at and say, oh, that's minimal loss in comparison to my loss. And other people may say, oh, that's a lot of loss in comparison to my loss. And so everybody is often at a different space. And when we're in treatment, we're working with clients, that's usually the thing that people say, hey, I realized this was happening, and that's why I came in. But everybody's is a little different.
Yeah. How else can alcohol or drugs change your brain, change the way you're thinking, and maybe affect the people around you?
How else can it?
Yeah.
I mean, I think the biggest thing and the takeaway is just what it's doing is the shame and the loss, is the hurt, is the pain. And that's not the only thing. We have so many people who come in and they are saying, I don't want to stop, or I've loved aspects of my life associated with this substance. You know, for some people, it's like, I love the party scene. I love the socializing scene. I love, you know, the people that I've been around. I love the way, you know, craft beer tastes. I love the way, I love going to breweries, you know, and it's not always clear, like, okay, everything is horrible. You know, there's also a grieving process in the sense of there's some good things that people have to let go of. But the way that it's impacting you, I mean, so many different ways. I mean, alcohol in and of itself is a poison. There's no longer the studies of, oh, a glass of wine at night is really good for your heart. Like, that has all been debunked. It is a poison to your body. They were normalized. It's something that we talk about, very common, of people having multiple drinks a week. And yet it's hurting us when we start to use it too often, too frequently. Frequency, intensity, duration. And that is going to look different for different people, but it's when the consequences start to increase that we say this needs to stop. So it is impacting the brain, it is impacting the body, it is impacting relationships, it is impacting mood.
Right. And so it starts as a choice, but doesn't always stay that way. You may not have control over it at some point. And so when we come back, we'll talk about, do you have to actually attend treatment to stop using? I mean, are some people able to quit on their own? So we will talk about that when we come back. You're listening to Healing Your Life with Soft Roast Recovery. And you can give them a call at 904-439-4805. We are here with the clinical director, Erin Moran, as well as senior therapist, Linsey, Mizic, and we are talking about addiction as a disease. And so before the break, we were talking about, does someone actually have to go to treatment to stop using? I mean, we all know somebody who says they quit on their own, and maybe they did, maybe they didn't, maybe they went to treatment, maybe they didn't want to talk about it, but I'm curious what your answer is to that. Do you actually have to go to treatment to stop using alcohol or drugs?
I don't think that there's ever a have to. We are all individuals. We all have different ingredients that make up our own lives. So some people maybe have an amazing support system. Maybe their use maybe they've become a pickle, but they haven't been a pickle for a long time. So with a great support system, with people who they can, practice and shift that relationship with. No, I think that there are people who can absolutely not go to treatment. However, there are some people who have tried to stop on their own, who, or they need the medical monitoring, so they need detox or residential, they need a higher level of care. I know we don't have that at Soft Roast, we just have PHP and IOP, so I view that as a full-time or part-time job. But the people who really do need it are the ones who, we need to change our environment. We need different people, places, and things. We need additional support, and we need to learn some of those tools. The amount of people who come in and are like, I never knew this, and what this might be is, I never learned how to communicate this. I never learned that there were more than just 4 or 5 emotions. I never knew how to develop alternative coping skills. And so that's where I think having treatment helps us to develop change. And what is happening we're on the brain today, but what's happening in the brain when you're coming to treatment is this thing called neuroplasticity. Our brain is hurting, it's kind of got a wound when we've overused substances for a period of time. And that can be really scary to be like, oh gosh, now I'm stuck. Or I'm stuck always feeling negatively about myself, or always having, high reactivity. I'm not able to receive feedback, or I shut down. Well, you're not stuck. And the reason that we're not stuck, and the reason that people can go through trauma or hurts and pains in their life and not just have that continuously happen, is because of this beautiful thing called neuroplasticity. This is our brain's ability to create new experiences. We do this in treatment through having a supportive environment. We do this from, in some ways I talk about like reparenting of ourselves, like I feel like I gentle parent my team gentle parents our clients gentle parent themselves. And that is what we mean, and that is being a little bit more balanced. We're holding ourselves accountable, but we're doing it with tenderness, grace, compassion. It doesn't mean, oh, okay, I made a mistake, that's fine, no big deal. It's saying, oh, I made a mistake, I don't feel good about this. This isn't what I want for myself. What do I want to do differently? Okay, I want to be more honest. I want to take a moment to pause and check in with myself before I speak or before I act. That's what it looks like. It's not, a lack of accountability. It's just accountability with kindness.
Yeah, when you said neuroplasticity, I was rejoicing inside because I thought, ooh, that means that your brain can repair itself.
Yes, it can.
And that's exciting for many people to think, oh, I didn't know that was a thing. Or once the damage was done, maybe that's it. But Linsey had a wonderful explanation and example, as she often does. And I think it really illustrates it for folks, how that can actually happen in your brain.
Yeah, and so thinking about, a lot of people will come in, they'll say, you know, I'm a tangible person, I'd like a real example, I'd like something that'll help me understand why I'm like this, right? So I might use the cup metaphor or something of the sorts, but another one that we talk about is being able to recognize that we as human beings are only meant to carry and have so much dopamine. And when we have an excess amount, that's where it becomes really overwhelming, and our bodies are trying to figure out, how do I recycle this? Because that's what we do, right? We recycle it, we get more, we recycle it, we get more. But when you have too much, it gets confused and it says, I don't know how to recycle this, right? So being able to think when you're drinking and it's in excess, or you're using and it's in excess to the point of addiction, the brain works in the same way your bladder would. So, you know, you take in all of that alcohol or the substances and it fills up and it fills up and it fills up with all this dopamine, right? And then when you're not using and all of that is flowing out and you have all of this extra space, but it's grown, right? Your bladder has grown into this space of, essentially what neuroplasticity will do is when it gets larger and it gets stuck there, where it's been a progressive disease, now we've got less dopamine and more space, right? So we've got all this space and the dopamine's bouncing around and it's saying, you know, why isn't there more of this? I'm confused. So we have cravings, the phenomenon of craving, urges, right? But it bounces back. That's essentially what the neuroplasticity is, right? It will come back and it will get smaller and it will be what the norm was before, but it's going to take time for it to come back.
My first question now is, how long does that take? So we'll answer that right after I give out the phone number really quickly for folks that have questions about this. This is intriguing about how your brain works today when you are addicted to a substance and how it can recover in recovery. Your number for Soft Roast Recovery in Jacksonville is 904-439-4805. Again, 904-439-4805 for Soft Roast Recovery in Jacksonville. We're talking with senior therapist Linsey Mizic and clinical director Erin Moran. So how long does it take once you decide you're going to stop using that substance? I mean, for your brain to bounce back?
Everybody's different. You know, and I think that that's, again, a very frustrating answer when in addiction, immediate gratification is the go-to, right? Has a drink, doesn't immediately become drunk, but there's immediate relief. You know, uses a substance, immediate relief. So that immediate gratification when I give this answer is never anyone's favorite thing. But that's the truth, right? Everybody's different. It depends on the substance you use. It depends on the length of time you've been using this substance. But also it depends on you and your chemical makeup. We may have clients that come in, you know, we ask questions of, you know, have you had blood work done? Have you had your liver enzymes tested? You know, for men, have you had your testosterone checked? You know, these things, because alcohol and substances impact those things. Some clients, you know, they may be, you know, people have been struggling for 20, 30, 40 years and their livers are great. I have some people that may be struggling for 2, 3, 4 years and they're not. So that difference of that bounce back is really different for everyone, which I think partners very closely with what your predisposition may look like. Right. Those things are probably very closely intertwined. There's no research that can back that up yet, but that's something that, you know, the substance community has really been working on, is trying to figure out, like, how do those things line up, right? How are they connected?
Right. And we're talking about, you know, do you really need to go to treatment? Can you do it on your own? Of course, I've known people that really did quit on their own through various ways. And so, you know, you have all the tools. You're just talking about medical testing, which is wonderful. And you can figure out, you know, you both have the approach of mind, body, soul, and they're all connected. And so to be able to go to treatment and have that testing and the therapy available and all the tools you have, what is the benefit of saying, doing it on your own, going cold turkey, as they say, white knuckling it, as opposed to coming to Soft Roast Recovery?
So I would, I'm going to go out on a limb and say I would never recommend less help over more.
Yeah.
Right.
It's there's no such thing as too much care. might feel a little uncomfortable if it's not something that you're used to, but the benefit of coming to treatment, the benefit of coming to Sophros is that you don't have to do it alone, that you don't have to be stuck in that shame. You don't have to be stuck in these parts of feeling like, what is wrong with me? Or I'm a bad person, I'm a bad, spouse, parent, sibling, child, all of these things, because we're struggling, and that's the part we started in the beginning. No one is like, sign me up for addiction. Like, I want to be an alcoholic. I want to be an addict. Like, yeah, that's a great life. Like, no one is choosing that. And most people are using, I don't want to say fully innocently, there could be various parts of it, but most people aren't using in the sense of, I want to blow up my life.
They certainly don't start out that way.
They don't start out that way. And that is the part that it is a progressive disease. The use of it increases. And so having support, having a team of people who can provide you those education, provide you those tools, can have those conversations with you when you're maybe about to relapse or life around you is starting to get more and more chaotic. You're starting to get sober and you're like, cool, this is really good. And then the rest of life is blowing up around you. Maybe it's because we lit the match when we were still actively using.
Yeah.
We can help hold that space to get through those hurdles that are going to come.
Yeah.
And that's hard to do alone.
Yeah. And I've known people that stopped on their own with alcoholism, and they are what we call a dry drunk, because beyond quitting, you may not be drinking, you may not be using, but there's so much more than that, Linsey.
Yeah, the behaviors and the feelings stay the same a lot of the time, right? And that's a similar term we use, is the idea of being a dry drunk, is not learning how to challenge things that you didn't know you needed to challenge, not knowing how to challenge things that you didn't know were exacerbating the use or the drinking, right? If you don't know the things that have triggered it, but you're sober, then you're going to keep doing those actions thinking that those are just the things you do, right? And they may be, but they probably don't feel good. And they are the things that led you to say, I need relief right now, right? I need immediate gratification to feel better. I mean, Erin had shared a little bit earlier of, the things that people come in and learn may be from the place of, I didn't know there was more than a few emotions, to having some sort of self-awareness and then deepening that to a level where they feel they gain humility and feeling, more connected to themselves and their families in a way that they never even thought was possible.
Right. Resiliency.
Yeah, it's huge.
Surrender, flowing with life.
Yeah. So the ultimate goal is not just, let's just stop drinking, let's just stop using.
Yeah.
There's a world beyond that.
It's the figuring out why. It's the depth of why. And the why may be really quick to answer, to say, because I feel better and I feel relief. There's a further why. There's always a further why. It's the cheesy cliche of when people come in and they say, I don't want to talk about my childhood. Let's not talk about that, right? We are just big little people. I say that all the time. We are big little people. We are just run around in the rain. Go do something that makes you feel good, because it's going to shoot dopamine up. It's going to feel silly, but you're going to feel good. And we're just big little people. And when you can revert back to those things and exist in less embarrassment about things you like, you will have there will be less likeliness that you will struggle to exist with just you.
I love it. We're all big little people. I mean, we all have that little child within us.
Absolutely.
That's always there.
Yes.
So we're wrapping up today on Healing Your Life with Sophros Recovery. Let me give you that number one more time. Thanks so much, Erin and Linsey, for having this wonderful discussion once again, as we do every Sunday at 1 p.m. And the number, if you have questions, this is something you can talk about, or if you're worried, maybe that this is affecting your brain or your body, and obviously your emotional state, then you can ask them questions about that. Are you ready for treatment?